Hi everyone, Dr. Sabrina here, Arc of Life Chiropractic, and today we'll be talking about the Webster Technique. The Webster Technique is a specific chiropractic analysis during pregnancy. Actually, I use it on some of my patients who are looking to get pregnant as well. And we know that the body is intelligently designed. It's designed to heal from the inside out. We as chiropractors, what we do is we look for misalignments in the spine that can cause nerve interference. And when we remove that nerve interference, the body is designed to do what it needs to do. So in pregnancy, what we're making sure that we're looking at is we're looking at that spine as well as the pelvis. And it's so important to have a spine and pelvis that's as perfectly aligned as possible so that you can have the easiest labor and the easiest pregnancy. So now let's go over some structures in the body. So right here, these are the ilium bones. So there's these big bones, as well as you can see the femur or the legs, they attach into this acetabulum. So this whole dynamic right here is the hip. We also have the sacrum. So the sacrum is one of the most important bones during pregnancy. And then we have that coccyx. So the coccyx, in addition to the sacrum, when it comes time for delivery, these two bones go into nutation and counter nutation. And so what we want to see for these structures is we want to have good alignment as possible. So this has maximum amount of give, because we know baby exits through here, so then we want that sacrum and coccyx to open up as much as possible. On the front, we also have pubic bones. So these pubic bones, they attach right here at the pubic symphysis. This pubic symphysis is made up of cartilage, just like all the other intervertebral discs in the body. And what tends to happen with the pubic bone is as we go throughout our pregnancy, that relaxin starts kicking in, and the pubic bone tends to want to separate a little bit. But not only that, we can get that pubic bones, either one can go a little bit superior or a little higher, and one can go a little bit lower. In addition, we have that round ligament. Have you ever heard of the round ligament pains? Most people experience it around week 16, 20, and they attach to the pubic bone, goes to the sides of the uterus. So it's about the size of a pencil or a pen, and they go to the sides of the uterus. So do you see that if there is a misalignment of the spine, say we have a torsion in the pelvis where we're going forward like this on our left, well, it can be really tight and taut in the round ligament right here on the left, so then baby might only be able to be right here on the right. So what we do as a chiropractor is we work on the back as well as the front to loosen up the ligaments, and so that baby can be in the most optimal positioning. Not only that, we have this psoas muscle. Do you see how big of a muscle it is? It attaches on that lumbar spine, and it goes to this leg right here. So a lot of people who do a lot of running before they get pregnant, people who do a lot of sitting at the desk, we're always in some sort of flexion like this. So that means the psoas muscle gets shortened. And so during pregnancy, as everything starts loosening a little bit, we might get a psoas muscle that might be really tight, really taut. So we work on the round ligament, the psoas muscle, and in addition, we work on freeing up the restriction in these areas right here. So this right here is called the SI joint. So they should go equal and opposite in motion. When you're walking, when you're moving, it should go like this. What tends to happen is during pregnancy, maybe we're sleeping a little funny, maybe we might have a little bit of a rotation. So on this side, instead of it going that full forward and back, it gets stuck right here. So what I'm trying to do as a chiropractor is make sure that we're identifying the restriction in the body so that you have good motion this way. So some of the conditions that might arise during pregnancy is sciatica, low back pain, neck pain. Now that the relaxin starts kicking in, you might have a little bit of round ligament pain. The round ligament pain tends to manifest during like weeks 14, 16, working your way up. And it's kind of like the lightning pains that you feel on that anterior region. But let's first go through, let's start with sciatica. So do you see this nerve right here? Do you see it in comparison to all these other nerves? See the size of this. So with sciatica, what can happen is your body's going through a lot of altered gait because of the relaxin. Maybe you're sleeping a little bit funny. So the muscles can start to get a little tight. There could be a little bit of more inflammation. And not only that, that SI joint can cause a little bit of a restriction, causing compression of the sciatic nerve. So a lot of times our pregnant women will come in with pain and numbness down the back of the leg. And with sciatica, it sometimes can be just a simple adjustment, moving that body into proper mechanics.